First doubt is sex going to be painful?
So, at what age are people becoming sexually active in India?
See, masturbation is absolutely normal.
Is porn good?
Porn is good because it sort of opens up people to learning more experiences. Guys have a question of, I don't want to ejaculate very early. I'm going to go with my partner. I'm scared. I'm not ready to do it. How to last long. Porn is, again, a well choreographed movie.
A boy needs a place and a woman needs a reason. So, in our series of health focused podcasts, today we have a very special topic and something which is very serious and very important, but in India we don't talk about it. And the topic is sex. Today we have a very special guest, Dr. Pratik, who has taken out time to be with us. Dr. Pratik is a specialist in infertility and he's an embryologist. Thank you, Dr. Pratik, for visiting us and taking out time.
Thank you for having me.
So let's start with the younger generation, right? Who have just gotten sexually active. So early 20s, even maybe 18-year-olds, 30s. How comfortable are these people talking about it? How comfortable are they? Do they know what they are really doing? And are they your patients? Do they come to you?
Yes, in fact, I do get a lot of messages on DMs because I think social media has made it very easy for people to reach out to doctors. Initially, they would have to book an appointment through various apps, Practo, Justile, so many apps. But now they can just drop a message, book a consultation. And I think the younger people, they are in a way much better off because now they're exposed to so much information
Okay.
compared to people of, say, my generation or the generation before me, because social media was not active in the beginning.
Right.
Now, from a young age, these people are exposed to so much information, which is also good and bad, because so much information means that there's going to be a lot of misinformation also. And separating them is not something that they can do right now.
Right.
But I think they're in a much better place than we were.
So at what age are people becoming sexually active in India?
That's a very good question. Now, the legal age is 18.
Sure.
Anything under that comes under statutory rape. But I think people have the tendency of exploring a little bit early. So, but yeah, I think a safe age would be between 17 to 19 is the time when people become active.
Sure.
And they know it very well that 18 is the age. So they wait for their 18th birthday.
Okay.
They're too excited. So I think 18 to 21 would be the bracket when they're actually willing to explore. They're exposed to all the pornographic material pretty early on with their friends and all. That's the type of sex education we don't want, but it happens.
So since you mentioned porn, is porn good?
That question has two answers.
Okay.
Everything in moderation is all right. If you exceed that limit, now you're just making your day all about watching a video and masturbating. If you do it in moderation, it's fine. It's just like any other vice that you have. It's not even a vice, it's good for your body. Even we as fertility doctors, we say that your abstinence period, you should not masturbate. Or when you come for a test, should be between 2 to 7 days.
Okay.
Right? So if it's longer than that, we would ask you to masturbate. Then we would ask you to come again and give a sample in that time bracket.
Oh.
Yeah.
Okay.
So porn is good because it sort of opens up people to learning more experiences, to finding out what they like, what they do not like. And there are a lot of categories. They can browse according to their wish. Believing what happens in porn happens in real life, that's not right. Because porn is, again, a well choreographed movie. A lot of things happen behind the scenes. People take it as it's happening and they want it to use it in their daily lives. That's never going to happen. So I think having that differentiation and making sure that you don't waste a lot of time just being glued to your phone screen watching porn. If that's not the case, then it's all right. You can obviously watch it and explore what you want to explore.
So you touched about another topic which is extremely taboo. People don't talk about it, which is masturbation.
Yeah.
Now we've seen that video clip where this Babaji is talking about how masturbation is bad, and in fact it's almost anti-religion, it's anti our scriptures, and people should not, whatever, he's giving multiple reasons. What do you think about it?
See, masturbation is absolutely normal. It's a good way to find out what makes you aroused. It's a good way to explore your own body, both for men and women. It's a good way to find out what you would like when you are with your partner. But there's another side to it. And so now there was a movement that started called the NoFap movement, that people should abstain from masturbation. The movement started in 2011 to tackle porn addiction.
Oh.
But as it developed, people confused masturbation with porn because every time you watch porn, you masturbate. But you can also masturbate without watching porn. And all the benefits that masturbation has, stress relief, better sleep, it's absolutely physiologically normal, which is a normal function of the body, to masturbate. They took all the benefits and they applied it to NoFap. And then there were a lot of anecdotal evidences saying कि हाँ मैंने masturbate नहीं किया, मेरी life अच्छी हो गई.
Oh.
तुम्हारी life अच्छी हो जाती. But now that you haven't masturbated, you want a reason to attach to it. Like you're working towards you achieving a goal that you can also do when you're masturbating.
Right.
But now that you have not done it, you feel this is the reason it's happening.
Interesting.
It's absolutely normal.
Right. So younger people also come to you.
Yeah.
People in their 20s or whatever. What are the common problems they come to you for?
Very early on, the most common problem that especially girls, their first doubt is sex going to be painful? Because I think the movies and all, they have sort of perpetuated a fact that the first time you have sex, it's going to bleed, it's going to be painful, it's going to hurt. It's not like that. But वो doubt इतना strong हो गया ना अब सबके मन में कि सबसे पहले ये आता है कि I'm going to go with my partner, I'm scared, I'm not ready to do it. So will it hurt? It should not hurt, ideally.
So girls have that question.
Yeah. And guys have a question of कि हम ज़्यादा देर कैसे, how to last long. I don't want to ejaculate very early. These are some questions. They have a performance pressure anxiety, and girls have an anxiety of feeling that it can hurt, sex will hurt. And if the first experience is bad, you sort of take that into your every future sexual experience. A lot of people have.
And are both these problems coming from media?
A lot of it is from media. A lot of it is from, the beliefs that have been passed on. Like there is a certain pressure on boys to perform. It comes on your masculinity if you cannot, like last longer. But I think that pressure, it sort of scares people. The pressure should not exist. It scares people. And even for women, virginity and hymen are like, it's a very strong subject, especially in our country. There's no medical basis for virginity. But it's not included in the medical text.
Okay.
There's no such thing called virginity. It's purely a construct, a societal construct. And I think that also makes people a little bit more कि हम शादी के पहले कुछ नहीं करेंगे. They don't want to explore. And when they go into their marriage, and it's not a pleasant experience, it's a painful experience, it also affects their marriage.
Very sad.
Yeah.
So I have a doctor friend who was telling me that the majority of cases that come to this plastic surgeon are for making women appear virgin again.
Yeah.
Which is crazy.
Yeah. So the procedure is called hymenoplasty.
Okay.
They will restructure a tissue like hymen. Now, hymen is a tissue which probably has no work. It has no work in the life inside the vagina. And sometimes it's present, sometimes it's absent from birth, sometimes it's like a flap, So sometimes the flap covers the whole vagina. So that's an imperforate hymen. That needs to be surgically removed. And sometimes it's just not there from the beginning.
Okay.
So hymen has no role to play.
Right.
But वो virginity के concept it should bleed, the tissue should tear.
Right.
Hymen has become a very important tissue in our country. It should not. It has no work. It does nothing. But yeah, I mean, people give it too much importance. There's a branch in gynecology called cosmetic gynecology.
Okay.
So now cosmetic gynacs, they also do hymenoplasty for people who want to get it. And see, while the procedure itself is very questionable, because you're sort of promoting the taboo which you should not be promoting.
Sure.
But then you look at it from the patient's eye, वो आके बोलेंगे कि अगर हाइमेन नहीं हुआ हमारी शादी टूट जाएगी, या अगर हाइमेन नहीं हुआ तो especially in old village wale areas that that they will beat her, and a lot of things happen, a lot of extremely unfortunate things. So then it makes sense for cosmetic gynecologists to step in. So there are both sides to the story.
Wow.
We are looking at it from a medical perspective.
Yeah.
But we also need to see it from the patient's perspective.
So in the reality, in lives of people, it is actually a problem.
It's so deeply rooted now that people perpetuate it without having the idea that they're doing it even unknowingly.
So on one side, you're saying the girl's fear is, will it be painful?
Yeah.
What's the advice to that?
The advice is that, only have sex when you're sure of it, when you're ready. Go slow. Like the girl has to dictate the pace. Use a lot of lubrication, so that it's easier. It'll help ease the penetrative sex, and just Go slow, go very slow. You don't have to rush into it. There's no need to just like go and bang. Take your time, go very slow. And when you're comfortable, then increase the pace, vary the pace, So that way it's not painful.
Hmm.
That pain part, it can be completely avoided.
Okay. And on the other side, the guy's fear is, will I last longer?
Yeah.
Maybe am I big enough?
Yeah.
And how much do those things matter? And what is the advice for them?
So those things did not really matter because the average time a man lasts is anywhere between 5 to 7 minutes. That's the average time. So when you see in porn movies people lasting for an hour, that's a shoot which has gone on for a full day. And even they need fillers, which are non-pornographic actors, to get them erect again.
Oh.
Because they cannot get erect in a scene otherwise. Because they've already worked with that actress before. The chemistry is matching. They probably know each other as friends. So when they have to act, they get fillers, people who they don't know, to get them
Okay.
erect again.
Okay.
So it's a huge production. It's a scene. It's sort of behind the scenes thing. Now people, especially with this pornographic movies, there's a body image issue also that, am I big enough?
Right.
The average size is anywhere between 4 to 6 inches. That's the average size. Every size is perfectly normal. There are positions you can use for your size. If it's too big, it can actually cause the wrong kind of pain to your female partner and can discourage them from having sex. Also, penetrative sex is not the best way to orgasm for a woman because all the nerve endings are on the outside, not inside the vagina. So no matter what your size is, if you just keep thumping, it's not going to do anything. It's like a machine.
Right. And that brings me to another very interesting question. So I've gathered some questions from
Yeah.
people. And the question is that the perception is that the boys are interested in their own pleasure, right? They don't really care about is the girl getting pleasure out of it,
Yeah.
in our society at least. And the girls are almost victims who are, they've been conditioned to give pleasure to the boys, especially in marriages, arranged marriages, and all that. So on one side, the boy is saying, I need to be big because that's his masculinity. I need to be aggressive.
Yeah.
But on the other side, that's not giving pleasure to the woman at all.
Not at all. Yeah.
Right? So there seems to be a mismatch there. Now, the guys in most cases do get their pleasure. In what percentage or how big is this problem that the women don't have an orgasm?
So there's a thing that we call as an orgasm gap.
Okay.
It's if people are having sex, how many men orgasm compared to how many women orgasm.
Okay.
The orgasm gap is so large, there's a difference over 30% to 50%. So
Wow.
say 50 women are orgasming from a sexual intercourse, it's compared to 100 men orgasm from the same sexual intercourse. The gap is huge. And the gap comes from the fact that, in a lot of time when guys are having sex, when they are done, so our anatomy is different compared to a girl, right? They can have multiple orgasms. Men cannot have multiple orgasms. In very few rare cases, you can probably have 2 rounds in one go. Otherwise, you have something called a refractory period. So once you ejaculate, for 30 minutes, you go on a downtime. So usually when that happens, you're like, I'm done. I don't want to contribute. Now that's wrong. So what people can do is actually help the the partner reach orgasm first with more foreplay, and then going into penetrative sex. So that way both the partners are satisfied and the orgasm gap is closed. Otherwise, the issue will just keep on happening.
But that gap is almost 30 to
huge.
50%.
Yeah, it's huge. The gap is right now, it's pretty huge.
So only 50% times the woman is
compared to 100% of time men orgasm.
right. Right. Wow. Oh, that's crazy. And then there are other perceptions, and a lot of them are largely men driven. Right? They're driven by boys. One is that boys want to have sex without a condom. Is it because they'll get more pleasure out of it? Or is it again coming from movies? Like, where is this coming from?
So I have actually, I get a lot of questions from female partners that, that my boyfriend or my husband does not like to use a condom. And they'll come up with the most weirdest excuses. That the condom does not fit me. Or I lose erection when I'm trying to put on a condom. I mean, of course, it becomes a little bit of an issue when you're in the moment and you're opening a condom, and you can, your mind can waver. But these are some excuses, and we don't get the same sensation when you're wearing a condom. Now, all of this come from a place where they just have to feel it raw. Otherwise, the condom will not affect your sexual experience in any way. It's all in the head. It's like a placebo effect. When you wear a condom, you can still be engaged with your partner to maintain your erection. You know, the condom is not going to affect how you feel when you're inside
Right.
your partner. And it's definitely, there are videos, people are opening up condoms, putting on their heads. So, yeah, you're definitely not too big for it. Like, they will cover their whole hand with the condom.
Oh,
Yeah. So, I mean, saying that it doesn't fit me
right.
is not really a valid argument.
Right. So the other thing is that a lot of times men don't want to have, or there is a issue of hygiene or safety when the woman is on periods.
Yeah.
They don't want to have sex. Is there a problem? Is it okay for them to do it? Is it unsafe? Is it unhygienic? What's the reality there?
So, it's not unhygienic. Both the partners, they want to try having sex on their periods, they definitely can. हाँ, थोड़ा messy ज़रूर हो जाएगा because you know there will be the menstrual blood
Sure.
coming up. उसके लिए कुछ नहीं, you can just put a towel on the bed, put a dark towel on the bed and do it in the shower if you want to.
But unhygienic nahi hai.
Unhygienic नहीं है. I think the choice should not be men's, the choice should lie with the female partner. Because period उसको हो रहा है. You know, she is going through whatever the pain, the cramps that come with it. So अगर she is willing and then the male partner is willing, the first choice should always lie with the female partner.
But I think Indian society में the choice is more with the man. Is that what you see?
Yeah, because I mean हम एक patriarchal society में
हाँ,
हैं
हाँ,
तो
हाँ.
हमेशा से ही बोला जाता है कि you know the man of the house and you know the man
हाँ.
has to do everything, but that's not the case.
On the other side, जो male pressure है, pressure to perform.
Yeah.
Do you get a lot of patients for that? Are there
yeah.
a lot of young boys जिनको fear है कि मेरी शादी हो रही है या क्या मैं will I be able to perform well? Is that also a big issue?
Yeah, and सिर्फ young लड़के नहीं, you know 30 years, 35 years जो काफ़ी टाइम से शादी में ऑलरेडी हैं या रिलेशनशिप में हैं, उनको भी ये इशू आता है because see at some point in time everyone will have an incidence of erectile dysfunction. Be it stress ho, if you had too much alcohol, you know, it's called whiskey dick.
Okay.
When you have too much alcohol, not necessarily whiskey.
Any alcohol.
Any alcohol. But whiskey sounds good, you know. Alcohol is a downer. Like it will suppress your
Okay.
body, you know, your
Okay.
reactions.
Okay.
So you cannot maintain an erection.
Okay.
तो ऐसा सबके साथ होता है. For whatever reason, stress हो, disease हो, alcohol हो, कुछ भी हो, it can lead to erectile dysfunction. But होता क्या है? अब जब next time they want to become intimate with their partner, जो पिछली बार का experience है, it will come into the head. So instead of focusing कि अभी क्या होगा और you know instead of enjoying that experience, उनके mind में वही चलेगा कि last time I could not get erect, can I get erect now? Will I be able to? That stress will become a vicious circle. So every time they go into it, they will have an erectile dysfunction.
Okay. And what's the cure? Is there a cure?
Yeah, there is. So now this is a psychological cause. It's just seeking counseling, just understanding.
So largely erectile dysfunction psychological है.
No, there are pathological causes as well, which are diseases which can lead to erectile dysfunction, diseases in the body, cardiac related disorders.
Cardiac.
Yeah, so your body will give you signs, and not being able to have an erection or not having spontaneous erections without a stimulus. It usually happens when you're sleeping, your body will have erections in the night, nocturnal erections. वो बहुत normal है, वो involuntary होते हैं, उसमें आपको कोई stimulus की भी ज़रूरत नहीं है, it's just your body's way. Erection is just blood flowing into your penis, और कुछ नहीं है. वो नहीं हो रहा है काफ़ी टाइम तक, और you know if you wake up and sometimes people wake up with an erection, it's also normal. It's called morning wood. So very interesting terms है. So they wake up and if for an extended amount of time you're not seeing it, that's body's way of saying that you have a cardiac issue.
Okay.
It's one of the first signs of a cardiac issue.
Oh.
Yeah.
So अगर किसी को erectile dysfunction है, तो should they get a heart checkup also done?
They should. It could be psychological. अब वो उनकी history पे, हम जब patient से बात करते हैं तो हम history taking is something that we consider an art, because that will give you everything you need to know about the patient before prescribing them tests or medicines. तो उनकी हिस्ट्री के बेसिस पे वी विल वांट टू फाइंड आउट कि साइकोलॉजिकल कॉज है, पैथोलॉजिकल कॉज है, या कोई पेल्विक रीजन में सर्जरी हुई है उसके कारण हो रहा है, और इट कुड बी अ फिजियोलॉजिकल कॉज आल्सो, यू नो नॉर्मली यू नो ब्लड फ्लो में इफेक्ट आ रहा है कुछ, समथिंग लाइक, एंड द ट्रीटमेंट विल बी बेस्ड ऑन दैट.
And should they see a doctor, or I mean, there are these days things like Viagra becoming very popular, and you know, so should they just go and take something? Is there a recommendation, or should they go and see a doctor?
सो पहले वायग्रा ओवर द काउंटर नहीं मिलती थी,
अच्छा.
यू नीडेड अ प्रिस्क्रिप्शन फॉर इट.
Okay.
अब चेंज हो गया है, यू कैन गेट वायग्रा और एनी अदर ड्रग, यू नो सिल्डेनाफिल सिट्रेट इज इन वायग्रा जो ड्रग होता है, sister drugs भी होते हैं, you know. तो you can get over the counter now. The rule has changed.
Are they safe?
They are short-term solutions.
Okay.
The problem with Viagra is, or any other drug for this particular matter, is that once you take it, so even if you have a psychological issue, which means your erections are normal, it's just that it's your mind, you know, which is sort of in a vicious circle, or as in that loop, you have a performance anxiety. So your erections are normal in that case. You take a Viagra and you have a good intimate time with your partner. Now, Viagra is not addictive,
Mm-hmm.
but you can get dependent on it.
Oh.
Because now you will think every time I want to get erect, I would need to pop a pill.
Psychological dependence or physical dependence?
Psychological dependence. Because even if your erections are normal, with Viagra you get a lot more blood flow. So I have seen patients come up to me and say that we don't have problems with our erections, but we feel they are much harder when we have a Viagra. तो अब वो फिजियोलॉजिकल साइकोलॉजिकल डिपेंडेंस आ गया है कि हम जब भी जाएंगे हमको बेटर इरेक्शन तब आएगा जब हम दवाई लेंगे और फिर वो हर बार दवाई लेंगे and that becomes a circle and then you cannot get out of it. Then it takes a lot of work to get off that dependency. जो दवाई की नहीं है, is just in your head.
And is there, so, you know, people are doing it at different age and stage and whatever. Is there an ideal frequency? You know, when people are in their 20s and 30s or even younger,
Yeah.
and they have a partner, whether a girlfriend or a wife or husband or whatever, what is normal sex is a big question.
Yeah.
You know, क्या मेरा partner है, मेरी शादी हो गई है, या girlfriend है, या boyfriend है, or should we have sex every day? Should we have sex once a week? And again, the perception is that boys want it very often. You know, the common line that I hear from younger people who I know is that a boy needs a place and a woman needs a reason
Okay.
to have sex.
Interesting. Very interesting.
Right? कि मतलब लड़के को तो बस जगह मिल जाए तो वो कर लेगा, लेकिन लड़की को थोड़ा माहौल चाहिए, environment चाहिए, emotion चाहिए, and all that. So, what is a frequency at which people should feel it's okay, I'm fine, I'm normal?
I think ये question answer करने का कोई तरीका नहीं है because you cannot quantify it. Even if you quantify it, you cannot validate it. You know, because everybody will have different needs. Everybody has a different sexual drive. Just finding that sweet spot where it works for both the partners and none of them is feeling, you know, left out is, I think, a good frequency. And yeah, I mean, there was a second part to your question that, you know, it's perceived that men want it more.
Correct.
That's not actually the case. As humans, I think everybody has a similar drive. Some people have a higher drive, irrespective of whether they are men or women. कुछ लोगों का drive naturally थोड़ा कम होता है. It could be due to a lot of issues. Hormonal issues हो सकते हैं. Societal issues. When people are growing up, they are told that sex is something you only do after marriage.
Yeah.
तो उस part के लिए, say they are getting married at 25. उस part के लिए, तब तक they will consider sex a sin. So that societal pressure, that also, you know, coupled with this, it suppresses the desires. So that's why I said that maybe women don't want it as much as men. As humans, we all have a certain level of desire, be it less, be it more, whatever. It's not based on your gender. Yeah, testosterone दोनों में होता है. Men में बहुत ज़्यादा होता है, women में कम मात्राओं में होता है.
Okay.
Same estrogen, progesterone भी men में थोड़ी quantities में होता है.
अच्छा.
So now it only depends on how you, because if you look at other countries, you know, वहाँ पे this difference is not that drastic.
Right.
अपने यहाँ पे ज़्यादा है because वो हमेशा से उस, you know,
Conditioning है.
हाँ, conditioning है और
शुरू से बताया गया है.
वो conditioning इतनी deep rooted है कि वो 10-20 साल से नहीं है. It's been going on for hundreds of years. So our parents are teaching us what they have learned. It's not their fault also. वो जहाँ grow हुए हैं जिस environment में उन्होंने जो सीखा है, they're passing that on.
Right.
And now the environment is changing. So now there's a huge disconnect between, say, a generation which is above the millennials,
Yeah.
and then the Gen Zs.
Yeah.
So in those generations में बहुत disconnect है with this, you know.